Yeah, good morning. Anyway, good afternoon. Yeah, I'm Eric Gyamfi presenting on assessment of efficacy of homeopathic remedies for the treatment of uncomplicated malaria. Yeah, this is a clinical trial study. Yeah, as I said, assessment of efficacy of homeopathic medicine for the treatment of uncomplicated malaria. Yeah, so we have complicated and uncomplicated. They usually have used conventional systems for the treatment of uncomplicated malaria. And homeopathy is also a new system of medicine which is not practiced in most countries. So I decided to test the efficacy of homeopathic remedy for the treatment of uncomplicated malaria. Now, here on the screen is a summary, yeah, of the whole trial studies. The study recorded a high efficacy level of both single and combination remedy. As well, the combination remedies work well with the multiple malaria parasitemia than would single remedy does. And I suggest this must be investigated. How come? The combination remedy worked well for the people with multiple parasitemia than the single remedy. And the study also recorded no side effect among the people recruited for the study. And at the end of the study too, because it was a clinical trial, the control group showed no improvement in their malaria parasitemia status after the study. And this study should be conducted at a national level to help provide an avenue for alternative treatment of uncomplicated malaria. Yeah, this also serves as a recommendation because the study was being conducted as a case study and it wasn't a nationwide survey or clinical trial. So based on the results that we had, we recommend that it should be conducted at the national level at least to ascertain the validity of the study and if possible to serve as an alternative avenue in addition to the well-known conventional system of treatment of uncomplicated malaria. Now, this serves as a rationale behind the study. If you realize that most estimated about 1 to 3 million people worldwide killed by malaria every year, and usually in sub-Saharan Africa with children the most vulnerable. You've also realized that there's a high level of growing resistance to anti-malaria chemotherapies associated with poor prevention programs and frequent inability of patients to pay for treatment. Yeah, because of high costs involved in the treatment of malaria. And based on all these facts, the researchers involved, including myself, based on the trial we conducted, we want to provide policymakers with information on how different alternative forms of malaria treatment could be incorporated into the system. Now, the background. Malaria is known to be one of the most important environmental related diseases. It has been very popular due to a number of attributable deaths annually, most particularly in Africa and in its sub-region. And for many years in research, malaria has been treated with a single and to a lesser extent a combined dose of anti-malaria drugs, and high level of resistance has been recorded in most clinical trials. And against this background, the study also proposed to carry out to see if alternative system of treatment will be effective. Now, objectives of the study. Within the homeopathic setup, we have a single remedy and a combination remedy. So whilst we were trying to compare the efficacy with conventional versus that of alternative system of malaria treatment, specifically homeopathic remedy, the study also sought to compare the efficacy of homeopathic single remedy and that of combination remedy for the treatment of uncomplicated malaria. So comparison between the single and the combination remedy. Then at the same time to generate baseline document for further research. So based on what the research will report. Further research can also be carried out. And here I have my materials and methodology, how the study was being conducted. The study type and the design was interventional clinical trial. And before the work was being carried out, an approval was sought from the College of Alternative Medical Research Committee, because the alternative system of healthcare, the conventional system of research ethical committee could not have given the approval for the go-ahead, except the committee from the alternative medical research from Institute of Alternative Medicine. Now, before participants were included in the trial, a pre-inclusion exercise was carried out. 100 individuals were screened for presence of malaria parasite in their blood sample, accompanied with clinical history taken of each individual. We did all these things to rule out whether a complicated form of malaria exists or not. And we realized that having gone through the initial pre-inclusion exercise, only 44 were eligible to be enrolled, and their status was classified as uncomplicated malaria per the World Health guidelines for classifying complicated malaria and uncomplicated malaria. Then inclusion criteria was given to people aged 18 and above for both sexes and absence of severe health condition. At the same time, a slight confirmed infection of falciparum, Plasmodium falciparum, not necessarily a mixed infection. Then auxiliary temperature of greater than 37.5 degrees, and ability to also attend stipulated follow-up visit, then giving informed consent by the individual to take part in the study, then absence of history of hypersensitivity reaction to homeopathic drugs, and as well being resident in the study area. So that is the methodology aspect. Now for the intervention, because the study was to compare both single and the combined remedy, we have a single remedy group and a combined remedy group. The single remedy group were given a remedy called hypersulfuricum, and the combined group were given aconite plus belladonna, gesemium, and bryonia. Whereas the control group received a non-potentized remedy, for which we call a placebo. And it was a single blind type of intervention. Then the treatment allocation was also made randomized. So respondents or participants were randomized to any of the group, being the single remedy group or the combined remedy. The participants were given the medication for the period of 14 days, after which and a second review of clinical laboratory review for malaria parasitemia survey was also conducted. Now, follow-up of the study participant, we followed the participant daily and recorded a whole lot of progress as well as that of side effects that may have been associated with the drugs. We noted them down per individual on daily basis. Now, after the 14 days intervention, the participants were re-examined for presence or absence of malaria parasite in their blood. Now, here is the findings after 14 days clinical trial. Now, we realized that overall we had 44 participants having malaria parasite that were eligible for the study, and out of these, 38 of them had the malaria parasite label +1, 5 had +2, and only 1 had +3. And out of these 44, we randomized them into single remedy group and that of combined remedy group. So per the randomization, 24 were being randomized to fall in the single remedy group and 20 per the combined remedy groups. And before the survey, the earlier malaria parasitemia status were known. So malaria profile for participants on single remedy before and after. So before the study, no one was having negative, because being negative will not make you eligible for inclusion. So all the 24 were having +1. and none of them had +2 or +3 for the respondent or participant who fell under a single medication arm. Now, after the 14 days intervention and having checked for their malaria parasitemia profile, we realized that out of the 24, 23 had a negative. Only one still maintained or retained the malaria parasite status in the blood, and that represents 98.8, and 1% also representing 4.8%. So that gives rise to the overall 24, which represent 100%. So from there, out of the 24 with the malaria +1, 23 recorded negative after the intervention. Now we move on to the combination remedy. And for the combination remedies, 14 participants were 4 under +1 status and 5 under +2 status, and 1 under +5 status. And after the 14 days intervention, realize that out of the 20, 19 also fallen under the combination treatment arm had their malaria parasite detected earlier cleared to 0. Now they are no more having the malaria parasite detected in the blood sample, having carried out the clinical laboratory analysis. And 1% or 5%, representing one person, also retain the malaria parasite in +1 status. And that means all the participants with the malaria parasite level 2 and 3 got the malaria parasite in the blood sample after the intervention to be 0, except one person from the group with the malaria parasite status of 1. So there was a little issue as to how come, and that also called for another critical analysis as to why people with the +3 status and the +2 status could be reduced to 0 and yes to 1. And per the issue of homeopathy, individuality counts a whole lot, even though they all receive the treatment, but individuals may have certain peculiar factors that may have or not supporting that particular drug in fully working. Now we come up to say, now comparing the success rate of this current study involving the use of homeopathic remedy to previous study involving conventional anti-malaria drugs like ACT and others, there exists a large evidence of homeopathic remedy being effective for malaria treatment than the conventional anti-malaria drugs, in which some of the success rate reported were very low. Now, looking at some of the clinical trials carried out in most African settings with artesunate, modafinil, or artesunate-based combination therapy and many other effective anti-malaria drugs, we realize that very many reports or research report percentage efficacy between 40 and 50%. But comparing that to the case study that we just carried out, we realized that 95% even to 99% success rate was achieved. So we encourage that the homeopathic system of healthcare, which is not well rooted in most systems of medicine in Africa and other sub-regions, should be incorporated. Now, we come to the conclusion. In the study, we realized that no significant difference was also observed between the two groups, that is, the single remedy group and the combined remedy group, in terms of the efficacy, so long as the single remedy could reduce the initial parasite of 24 status to 23 and that of the 20 to 19. Both recorded 95.8 and 95% efficacy. Now, this indicates that homeopathic remedy in whatever formulation stands an almost equal rate of treating uncomplicated malaria as documented by the present study. Now, the participants on the control group also show no improvement at the end of the study, which was 14 days duration. The little or no harmful side effects were also noted throughout the study as compared to other therapies in the previous trial, in which significant effects were recorded. Yeah, so this is the conclusion of the study. Then, based on the results of the study, the following recommendations are also put forward. Now, It is therefore recommended that the homeopathic remedy be advocated on nationwide usage, as it has about 90 to 95% success rate for the treatment of uncomplicated malaria with no or minimal side effect. Again, it is also recommended that the research be reproduced on a larger scale, involving large samples of participants in a different geographical location to ascertain the validity of the present finding. Now, the trial should be repeated to have the single remedy being evaluated for patients with multiple plus MP status. Why? Because per the randomization, almost all the participants that fell under single remedy group were having single malaria parasite profile. So we also encourage that another trial should be carried out for which we may have some of the participants having multiple malaria profile to be allocated to the single remedy to ascertain whether single remedy could also be effective in the treatment of patients with multiple plus of
Thank you.
malaria parasite.
Thank you, Eric, for your wonderful presentation.
Yeah,
And